Good morning, good afternoon, and good evening to you. Welcome to TFH, the Full Hundreds, where the truth's told. Today is Wednesday, the 8th of July, and today I really have to bring you guys up to the goings-ons around the COVID situation. It's really, really drastic, and there's not going to be a lot of talking on this. The news is just going to tell you what's happening. So without further ado, guys, let's get to it. Now, I want to start with a world map and a world view of where we are. We're going to touch on the US. We're going to touch on Australia, who's shutting internal borders between two regions. First time in 100 years. Last time it was shut was during the Spanish flu 100 years ago. Then we're going to touch on India with the largest hospital ever seen in the world, because now they're in trouble. And then we're going to go to Israel. Then we're going to go to Latin America. And we're going to finally finish in Spain, who have breaking news for us. So guys, take a look at my first video, a quick world roundup of where we are with COVID. It's pretty bad. Take a look.
So around the world, 11.7 million cases are confirmed, with more than 500,000 people dead of the virus. The World Health Organization says that since April, new cases have now doubled to 200,000 a day, and it says the virus is only speeding up.
Guys, now we're going to go to America. Many of you who ain't watching the news are really ignoring or not noticing a genocide. Genocide might be a strong word, but if you refuse to take care of your people, then you are no different to a foreign power or foreign agent who comes in and commits genocide on your people. I mean, tell me what the difference is between, they've lost right now over 130,000 people, and Trump still refuses to wear masks. Is still making masks a strongman thing. If you wear masks, you're weak, so that he can win over his little 18% of nuts cult cases, and try and make his opponent to be weak, when the rest of America know his opponent's the smart people. He's a smart one. So take a look at what's getting in America, guys. It's sad. It's annoying and sad. I'm not even American. Take a look, guys.
Urging coronavirus, it has broken its own record for new daily cases. Johns Hopkins reports more than 58,000 infections on Tuesday alone. The nation is closing in on 3 million cases in all, and spikes in more than 30 states. And this could just be the beginning. According to one projection, the death toll, now around 131,000, will top 200,000 by November. But one expert tells CNN's Anderson Cooper there is a way to save thousands of lives.
If people would wear masks, if we can get it up to that Singapore level of 95% of people wearing masks through, for example, mandates, that can reduce the death toll by November by about 45,000 deaths.
Cases surging in the Sunshine State. More than 7,300 reported on Tuesday. 43 hospitals in Florida report their ICU beds are now at capacity. Nearly 3 dozen more are close. Yet the governor is pushing forward with plans to open schools next month, touting his state's efforts to prepare for the long haul. Than 10,000 new cases, its highest single-day increase. Houston's mayor urging the state's Republican Party to cancel its upcoming convention in his city, scheduled for July 16th.
I believe canceling the in-person convention is the responsible action to take.
The Texas requirement for attendees. Meantime, the Texas State Fair canceled for the first time since World War II. The governor now saying he allowed bars to reopen too soon.
Guys, now we're going to go over to Australia. Now, you guys haven't heard a lot about Australia. I haven't spoken a lot about Australia because I haven't heard a lot about Australia. What I do know about Australia is Australia and New Zealand. When New Zealand got rid of his problem, and my hero, world leader Jacinda Ardern of New Zealand, they had, I saw a Teams or a Zoom meeting between the two world leaders and open up their borders to each other because they've done good. Well, surprise, surprise, Australia's now got a new outbreak. They have now done something that they haven't done for 100 years, and that's shut an internal border. So imagine UK and Wales, England and Wales activating a border they haven't activated for 100 years. Take a look, guys.
Melbourne residents are preparing to enter another lockdown as authorities scramble to prevent a second wave of the coronavirus. Starting at midnight local time, residents can only leave their homes for essential trips, including getting food, going to work, exercising, and caregiving. Now, the spike in cases in the state of Victoria has already forced the government to shut down roads in and out of New South Wales. For more, CNN's Anna Corn joins me now from Hong Kong. And Anna, you've been following the story. I know the Prime Minister just spoke again, and it really seems like they're, really serious in terms of even enforcing this lockdown, right?
Oh, absolutely. They are not mucking around. They've been taking this serious from the get-go and have been tackling the pandemic aggressively. That is why this spike in Melbourne, Victoria has really created a great deal of concern of the border between New South Wales and Victoria. That is now completely closed. It hasn't happened since the Spanish flu 100 years ago. The border between Victoria and New South Wales will be closed.
Welcome back, guys. We're now going to go over to India. India, you're about to see, has just built the largest hospital ever seen in the world. Why? They're in trouble. Take a look, guys.
The world's second most populous nation, India, seeing a big spike in coronavirus. Delhi's hospitals are struggling now to cope. The country is now fighting the virus with one of the largest field hospitals on Earth. CNN's Vidika Sood takes you inside.
Hundreds of columns of biodegradable cardboard beds, topped with mattresses and pillows, set up at a socially safe distance from each other with chairs by the bedside. That's what officials claim is the biggest COVID care center in the world. Located in India's capital, this facility is the size of 22 football fields. Delhi has been witnessing an exponential rise.
Welcome back, guys. That is shocking. We're now going to go over to Israel. Again, Israel's another country that not many people spoke about. Israel had a fantastic first run. However, they got too complacent and they opened too early. Take a look, guys.
The public health director has quit over the soaring rate of new coronavirus cases in that country. She says her warnings about trying to return to normal too quickly were in fact ignored. Israel won early praise for how it handled the pandemic, but now its reopening strategy is under fire. CNN's Oren Lieberman has the latest.
If Israel's first wave of COVID-19 was a success story, its second wave appears on pace for a very different ending. As coronavirus cases surge across the country, the government has reimposed closures of public halls, pubs, gyms, pools, and more. With unemployment already more than 20%, Prime Minister Benjamin Netanyahu is trying to avoid another complete lockdown. An official at the Ministry of Health resigned, saying her professional opinion was no longer accepted, warning that the country is approaching a dangerous place. To my regret, for a number of weeks, the handling of the outbreak has lost direction, she wrote in her resignation. Despite systemic and regular warnings in the various systems and in the discussions in different forums, we watch with frustration as the hourglass of opportunities runs low. In late April, Netanyahu said Israel had been successful in its mission to combat coronavirus as he began easing restrictions and opening the economy. But the mission isn't over yet.
Now, it doesn't bring me pleasure to tell you this. However, it's karma. I'm about to go to Brazil, and breaking news, the one person in the world who still maintained this wasn't a serious pandemic, that this was a flu. Jair Bolsonaro, the president of Brazil, surprise, surprise, he's got COVID-19 himself now. Take a look.
3 million of all confirmed cases in the world now come from Latin America and the Caribbean. That's according to Johns Hopkins University, and that's almost a quarter of the global tally. Countries like Peru, Mexico, and Chile are seeing some of the largest outbreaks in the region. But Brazil, with more than 1.6 million cases, is by far the worst hit. Brazil's president has consistently downplayed the threat of the pandemic. But on Tuesday, Bolsonaro announced he's tested positive for COVID-19. He's one of a staggering 45,000 new cases confirmed on Tuesday. It's unbelievable. Health officials also recorded more than 1,200 new fatalities, about twice as many as the day before.
The largest cemetery in Latin America is not large enough these days. And in his 25 years digging at Villa Formosa, and Denelson Costa has never seen fresh graves fill up so fast. There were 4 COVID families here this morning, and we're shocked, he says. Everyone is the same, 10 minutes max. No wake, no way to look in the coffin, because it is the last greeting they will ever give to the loved one they lost. And there is no time for a ceremony. Bill Weir, CNN, Sao Paulo, Brazil.
Now to my last video, and I saved this to last because, guys, we've heard of herd immunity. We've heard of we don't need vaccines if a high proportion of our population have got infected, and that means that those people can never get reinfected. Well, guys, breaking news from out Spain, guys. We all know Spain had a big issue. However, the breaking news is it looks like there is no herd immunity with this virus. We're finding out new things all the time with this virus. So all you guys hoping to catch it and that will protect you from the vaccine and you don't have to take it, watch this video and understand that of every 100 people that get infected, only 5 have immunity. 95 of you can catch it again and again and again. Take a look.
Well, a new study by the Spanish government finds that COVID-19 antibodies can disappear after just a few weeks. The study was conducted over several phases and found the number of people with antibodies declined over time. The health ministry says it shows herd immunity against COVID-19 could be difficult to achieve in the short term. And this news comes as Spain has been forced into new lockdowns to contain new coronavirus outbreaks. So let's bring in Al Goodman. He joins us live from Madrid in Spain. Good to see you, Al. This study is an unfortunate wake-up call, isn't it? How reliable is it? And what's the latest on Spain's new outbreaks?
Hi, Rosemary. Well, the prestigious medical journal The Lancet published this study, which was peer-reviewed. It's thought to be the largest in Europe. It had 61,000 people participating over these phases in a representative sample of the population, according to the government. And significantly, most of them participated throughout, giving blood several times to see if they had the antibodies. And that was achieved with the help of neighborhood health clinics like this one in that building. So here's the results. The results are that only 5% of the Spaniards had antibodies, okay, which is some sort of alleged immunity if you have the antibodies, but 95% did not. So
welcome back, guys. We've come to the end of today's video. My platform is a platform that isn't afraid to tell you the truth. We're not afraid to tell you who's messing up. I told you all to look out for right-wing governments and left-wing governments. Those of you still don't understand what I meant, now you understand. My government, the UK government, is a right-wing government. We hold a record per capita of deaths. They now are seeing how serious this is. Thank God. Brazil and America, they're knee deep in this, if not neck deep in this. We can only pray for those who they lead. Please stay safe. Watch your backs. Social distance. Believe in masks. Until tomorrow, we're signing out and we'll see you soon. Thanks for watching The Full 100 and take care.